Good morning, Christopher Ohl, Wake Forest Infectious Diseases. Where are we in the Delta wave here? So our cases are continuing to go up across the country. But if you remembered, the first place to see real problems with the surge in Delta virus was Missouri. And Missouri is starting to plateau now. And I think within a week, their cases will probably start to come down a little bit. Arkansas is still going up, although slower than it was earlier. And our main hotspots and our main problems now in the country are in Louisiana, across the southern Alabama, Mississippi, Georgia, and then Florida. Florida takes the cake. Almost 1 in 4 of all COVID infections right now in the United States are in Florida. Here in North Carolina, most of our new cases of COVID that we've been seeing over the last month or so are concentrated in the southeast part of the state. Here in the Triad, while our cases are going up, they're not quite going up quite as fast as some of the other places in the state, but yet they are going up. The vast majority, probably 90% or so, of our infections that we're seeing now in the state are in unvaccinated people. And I'm starting to see some percentages that actually make some sense now. How many infections that we're seeing now with the current Delta wave are in vaccinated people? It's probably around 5, 6, 7%. So it's not all that high. So if you turn on the TV, you would think that everyone, including the family dog and the birds out in the backyard, are getting breakthrough infections, and that's just not true. It's still a small number of people. We're starting to get a little bit of an idea about the severity of Delta. It is a bit more severe illness, and I think our local data here supports what England found during their COVID wave, is that it's about 1.8 times risk of getting hospitalized. So consequently, our hospital numbers here in the Triad are pretty high comparatively to the total case count in Forsyth County. Our total case count per 100,000 per day is roughly about 21 in the Triad. A little bit higher in the counties to our west and to our direct south and to our north. When we had that rate before, we didn't have quite as many hospitalizations as we do now. I really don't think here in the Triad we're going to have a real stressed out hospital situation like we did back in January and February, where we had to delay or put off elective surgeries and elective hospitalizations. I don't think it's going to get like that. I did some rough numbers with predictions based on England's surge, and I don't think we're going to get that far. Speaking of England, I've told you to keep an eye on their case curve, because that's really what's going to predict what happens here and across our country. And their cases are continuing to plummet from their surge. So it's about maybe, 8 to 10 weeks long from beginning to end. So if you put it that way, by Halloween, the Delta surge, with a little bit of luck, will be behind us. And so, which brings me to another point, is that there seems to be a kind of a mood in the country right now that's somewhere between frustrated, angry, depressed. And so I just wanted to bring up a few things. First of all is that if you remember, there were a lot of us, including me, who at the beginning of the summer said, we've seen enough of Delta and what it's doing in other countries that we're probably going to have a wave in August. And I didn't seem that worried about it then. And to tell you the truth, I'm not hugely worried about it now. But I did say that was going to happen. And I do remember saying we're in a bit of a sweet spot right now, so go out and have fun. Remember, around the 4th of July, because our cases were low. And because August, we're going to be starting to see our cases go up again, and that's what's happening. This is different. This wave is different. This surge is different. This whatever you want to call it is different than what we've gone through before, and it's different because we have a large number of people vaccinated, and so I'm going to kind of hone in on the triad area here, because COVID in a vaccinated person is a different infection when it breaks through, if it breaks through. It's a cold, so I'm going to actually start calling these COVID colds. And in an unvaccinated person, it's not much different. In fact, it might be even a little bit more severe than it was last winter. But in a vaccinated person, it's not. Does COVID transmit from between people, including vaccinated people? Probably some. The vast majority of transmission that's occurring is from unvaccinated to unvaccinated people. I think there are a few unvaccinated people who infect a vaccinated person and give them a COVID cold. And I think there are a few vaccinated people who infect unvaccinated people and actually give them COVID. There are a small number of vaccinated to vaccinated transmissions. So at this time last week, we were talking about the new mask mandate, I believe, not a mandate, sorry, the mask recommendations from the CDC, where they were saying wear a mask indoors. And last Friday, I finally saw the data that brought that up. So that data was an outbreak that occurred in Provincetown, Massachusetts, which is way out on the tip of Cape Cod. And that's a party area, and they have a traditional 4th of July party, and that's what happened. Did I talk about this last week? I'm getting mixed up if I did. So, so they had a big party. What's a big party? About 60,000 people from 22 states came to a town that's about 80,000 people in the wintertime, probably even less. And they got together and they partied in houses and they partied in clubs and they partied in restaurants and bars. And about 70% of these people were vaccinated, and they succeeded in transmitting COVID. It's a little bit unclear whether the initial transmissions were from unvaccinated to vaccinated. Probably were. And then there were a few vaccinated to vaccinated. We're still sorting out how many, but there were some. So what that outbreak proves is that when you're dancing in a club and you're jumping up and down and hooting and hollering, that you can transmit a COVID cold to another person. And that's not a surprise to anyone. So getting back to kind of the mood of everything, I don't think that we should be feeling, one, that the vaccines failed us, or two, that, oh my God, what are we going to do now? The vaccines don't work. Or that, oh, I'm just back into it again, just like it was last fall and winter, even though I'm vaccinated. None of that stuff's true. What that Provincetown outbreak was a stress test for the vaccines, and they worked. Because out of those 60,000 people partying there, and of the people who got it and who became symptomatic, all but like 5 people got a COVID cold. And it was really only 5 people who were hospitalized. And 2 of those had underlying medical conditions. So, so that's, I think, a way to put and frame things in. Does that mean I don't think we should be wearing masks indoors during the current COVID surge? No, I think when you're in public places, you should wear masks indoors. To tell you the truth, I never stopped from the get-go, the beginning. So I think we should be wearing our masks indoors. There are some exceptions when you're on your own household and nobody's ill. If you're with close groups of friends and everyone's vaccinated and you kind of know what your friends are, how they behave and what they're doing and how risk adverse they are to COVID, I think it's fine. And to tell you the truth, I think there's even some workplaces that probably don't need to mask if they're very heavily vaccinated and they're known to be, and people are taking precautions outside of the workplace. But otherwise, yeah, let's mask indoors. And how long are we going to have to do this for? Until the wave's over. So it's a matter of weeks. I'm not talking about months or years or lifetimes. It's really not going to be that long. You can be outdoors without a mask, and that's still fine because it's beautiful outside around here right now. So take it outside and take your mask off there. So I was going to give a little bit of some pointers, I think, for people on how to behave with the current COVID surge, and then I'll take questions for next week, specifically from people who watch, so we can approach some more. But I thought I'd just bring out some of the big ones right now. Do I have to cancel my vacation? No, I don't think so. I think you just do your vacation wisely. Let's say you're going to the beach. You go to the beach, and if you're going to have other people in your house at the beach, surround yourself with vaccinated people, friends and family. Those people, to tell you the truth, it's pretty unlikely you're going to get it. And if there is somebody who gets a cold in that situation, and you don't know if it's COVID or not, you could go get tested. If you can't get tested, then just put a mask on and curtail your activities and essentially self-isolate in that situation. If you're in that beach house that way, and people put a mask on in the beach house when you're in the house. When you're outside, you don't need to. So, so that's one example. Do I need to cancel my vacation to, I was going to fly to the Grand Canyon and stay in the national park. Do I need to cancel that? No. Wear your mask on the plane. Get your rental car if you can find one. And then if you're in public transportation, make sure that you're masked. Wash your hands often, or hand sanitize, and enjoy the Grand Canyon. So if you have kids who are under the age of 12 and can't be vaccinated, does that mean they really have to hunker down and lock down again and can't do things? No. Just be wise what you do. You want to go out to eat? Find a place where you can dine outside. You want to have a play date with your friends? Do it outside. Surround yourself with other vaccinated families where the parents are also vaccinated, and have your kids play. Because the parents vaccinated, and then the kids are less likely to pick it up. If you have to do a high-risk activity, which let's say you decide that you have to go to a wedding and there's a big wedding reception and it's indoors and this wedding's been put off for 2 years, so people are deciding to go ahead with it. Wear your mask indoors at the reception, hand sanitize, and then lay low for 3 or 4 days after the wedding reception. Get yourself tested. If you're negative, go back to your life. So it's just a matter of thinking about things. And to tell you the truth, it's not hugely different. You want to go to the fitness center? Go to a time when it's not so crowded, there aren't so many people. If there's more people than you thought there would be, even though it feels yucky, wear a mask. Or do weights off in the corner. Wear your mask there. It doesn't feel quite so yucky if you're doing weights compared to being on a treadmill. Church, what about church? Well, you're probably going to know a little bit about the other people in your congregation and who's going to church with you. If no one else is wearing masks in church, and you think that there's probably some unvaccinated people in there, I would probably watch church virtually or talk to your congregation about everyone masking again. Because if everyone's masked, it's fine. What about if you're immunocompromised or at the extremes of age, over 75, or you're vulnerable? You want to take more precautions than you normally would have. I'm assuming you'd be vaccinated. If you're not, go get vaccinated. But you might want to avoid crowded places, crowded times in public places. Wear your mask when you go. If you're immunocompromised, you can double mask, surgical mask underneath a cloth mask. Or you can wear an N95 if that makes you feel more comfortable. I still don't think you need to mask outdoors. So those are just some things about our behaviors. And feel free to pull up your own specific situations or questions and send them in. And we'll approach them next week. I don't have time to collate them and do them right now on the spot live. So international travel right now. I'm seeing people. I do a travel clinic, which means I get people ready to go international travel, particularly to the developing world. Shots, malaria pills, diarrhea medicines, such like that. And things are picking up. To tell you the truth, a lot of people are going back to visit relatives that they have in other countries that they haven't been able to see for a while. But there are some people who are traveling for fun, and a lot of that's safaris in Africa. It's a safari, it's outside. So even though there's a fair amount of COVID, if you take your precautions and you're vaccinated, bring your mask along, I think that's fine. What about travel to Europe? Well, most of Europe's officially open now to the U.S. people. Some you don't even have to quarantine anymore, like the UK, but you do have to be vaccinated, and there are a lot of testing requirements still. So if you're thinking of traveling internationally, do your homework first and find out where you might have to get tested. I had one couple going to Africa the other day, Kenya and Tanzania, safaris, and a little bit of mission work. And they said they were going to have to test 5 times during their trip, because you need to test before going from one country to the other, sometimes on arrival in a country, and then you have to get tested again within 72 hours before you can come back to the United States. So it's not, it throws a little bit of a wrinkle. Fortunately, a lot of hotels and airports now are doing testing. France is requiring proof of vaccination to enter a museum, a restaurant, a cafe, a bar, a club, basically just about anything. So unless you want to go to France and sit underneath the Eiffel Tower, you're going to have to be vaccinated. And they're going to require a vaccine passport to do it. And France, being France, wants their own vaccine passport. So you're going to have to figure out, when you land in France, how to get your COVID shot record transcribed into the French vaccine passport. So you might want to look into that if you're going to France. And then lastly, just kind of a word, because I'm hearing this from other people, a lot of Europe is not yet quite geared up for a lot of tourists and a lot of people. And I've heard about people having trouble getting service in restaurants, getting rental cars, and getting hotel service. Normally, if the hotel's got 6 or 7 people running it, they're small in Europe. Now they might have 1. So I don't know. I might put off my Europe vacation for a year until things kind of settle down and everyone gets their feet under them. So school's coming up. and that's cool. That's fun. I know a lot of kids are looking forward to going back to school. I think it's no secret that I believe that students should be coming back to school masked, K through 12. Our vaccination rate in public schools just isn't high enough for people non-masked. Obviously, there's kids under 12 who can't be vaccinated yet, and I think that with this current surge, that if kids don't come back to school masked, then there's going to be in-school transmission, and it'll soon get out and beyond the ability to do surgical contact tracing, which means to take individuals out of classrooms and have them quarantined. And that'll mean that it'll be an entire class quarantined or potentially the entire school. So if your kids aren't coming back to school masked, it's going to put the school year at risk. Here in Forsyth County, people are coming back masked. I think coming back to school is fine. I don't think people need to run out and sign up for the virtual option. I think we'll get through the school year safely. Our under 12-year-olds, it still looks like roughly right around Thanksgiving time frame, might be getting a shot. So for those who are under 12, look forward to your shot just after Halloween. FDA approval, when is it coming out? I've gotten a lot of questions about this lately. Nobody knows for sure because the FDA keeps their mouth shut about it. But there are some hints that I think it's going to be soon. And it would not surprise me if it would by the end of the month, first week of September time frame. Once it's FDA approved, it makes it easier for us a bit in our vaccine centers, primary care offices and such, to give the vaccine, and then we'll be able to get the immunocompromised people and vulnerable people who need 3 shots as part of their primary series. We'll be able to get them their 3rd shot. So I think it's not that far off. Why is it taking so long? I get asked that question for the full FDA approval. It's not because the vaccine's not efficacious, because it's very, very efficacious for severe disease, hospitalization, and death. And in fact, Moderna's vaccine came out just this week saying that it's still 93% effective against symptomatic infection. So pretty darn good, and that's at 6 months. And it's not because the vaccines aren't safe. We know a lot about these vaccines now, 350 million doses given in the United States, plus the data that we have from the clinical trials that got it the emergency use authorization in the first place. The reason why it's taking so long is because there's a certain process you have to go through to get a full FDA approval, and it has to be vetted by multiple groups, and they have to come up with the full prescribing information from all docs and providers based on that review and the regulatory review. There's a lot of things in best practices in manufacturing that are worked out, so things that have to do with the factory that makes the vaccines, transportation for the vaccines. Everybody gets involved, and it's a process. It's kind of a bureaucratic regulatory process, but it's an important one. And we do that for all medications, we do it for all vaccines, and we do it for all tests. So Nate, I remind you that every single medicine right now that's new that we're using for COVID, including remdesivir and monoclonal antibodies, is still on an emergency use authorization. And that every single test we're using to test people, so when that swab goes in your nose, goes off to the lab, that test is an emergency use authorization. So it's going to take some while to catch up for all these things with the FDA. And so, but it's coming soon. I really want to encourage women who are pregnant to get vaccinated. And I haven't talked about this for a while, but it's important. For one thing, we're seeing that COVID in a pregnant woman is a little bit of more of a nasty infection than it is in a non-pregnant woman, all other things being equal. Same thing with flu, by the way. In pregnancy, it's a little bit more severe. And so we've seen some really bad hospitalizations in some of our pregnant women from COVID. And now we also have a registry of a huge amount of data that says that that the vaccine is safe in pregnancy and it's safe for breastfeeding women. And the risk of thrombosis, which had come up, which sometimes people, when they're pregnant, particularly right around the childbirth time, get blood clots. It's no different if you've gotten the vaccine or not. In fact, your risk of getting a blood clot is immensely higher if you get COVID than from regular pregnancy or vaccination. So the American College of Obstetricians and Gynecologists, we affectionately call them ACOG, is reinforced and reiterated that pregnant women should get vaccinated. And I 100% totally agree with that, either pregnancy or breastfeeding. Primary reason, protect yourself, protect your baby. So, you've seen more vaccine mandates come out, workplaces. Latest one here that really affects North Carolina is Tyson's Food. I think that these are important, actually. And a lot of these workforces really got torn up earlier in COVID, including deaths. And those are all preventable with vaccination. And, you know, frankly, companies care about their workers. They also care about productivity. But the primary reason, and I can tell you that the primary reason in our healthcare system for our mandate is because we care about the people we work with. And then we also need to make our environment safe for the patients we care for, and our patients expect that. So, got a couple months if you're in healthcare in this area to get your vaccine. So check with your own healthcare system as to when those dates come up. Lastly, booster shots. So San Francisco decided to go rogue and is giving booster shots to people who've had Johnson & Johnson vaccine. So I've been asked what I think about that practice, and I say, you know, I'm not sure they need to be doing that, actually. Because right now, including in the Provincetown outbreak, it turns out that really all of the vaccines protected against serious infections and hospitalization equally. And so Johnson & Johnson wasn't any different. There may be a theoretic reason to boost Johnson & Johnson, but it's a little bit hard, right, to do it under an EUA. In fact, a lot of healthcare systems can't do it under the EUA, and the ACIP can't make the advice to do it under the EUA. And right now, I really don't see the need to boost, except for people who are immunocompromised. So here's the people who are going to be getting a third shot. Are people who have an underlying cancer or disease, particularly lymphoma or leukemia, bone marrow transplant, solid organ transplant, people who are on disease-modifying agents for rheumatoid arthritis or other inflammatory conditions. Those will be people who will be getting a third shot, and I think that'll be coming down the pike pretty quick. So be patient, it's not far off. People who are over the age of 70, particularly people who are frail. I don't know whether it'll be 65 or 75, so I said 70. Particularly people who are frail and people who are in nursing homes likely will get a third shot. The rest of us probably don't need one. So people say, well, what about all these boosts? What about all of these breakthrough infections? If I get a booster, I won't get a breakthrough infection, right? Not necessarily. So let me explain to you a little bit of infectious diseases science. So this is your next class to get you to your full infectious diseases certification from watching Dr. Ohl for 2 years during the pandemic. If you get, let's say you get COVID, and you get it from another person, what happens is the virus from that other person gets in your nose. Either directly through a droplet, sometimes through an aerosol, but usually through a droplet, or you touch something or somebody and then you don't get your hands sanitized, and then you put it in your nose yourself. That's a little less common. Very less common, actually. But it gets in the nose. Then you get replication of the virus in the tissues in the nose and behind the nose and in the throat. And it replicates there. And then you start to feel, because those tissues swell, you start to feel stuffy, you start to feel congested, a little bit of a sore throat. You may think you're sneezing. You may be not sure if you have an allergy, and then you decide you might have a cold. Some people get a little bit of fever and achiness with that. Some people still get a loss of sense and smell if it's due to COVID. But when that happens, the nose says, hey, immune system, COVID up here, come on, need your help. And your immune system responds, and it terminates the infection in the nose and throat. And that's the end of it. So it's kind of like you get a little grease fire in the pan on the stove in the kitchen, you get the fire extinguisher, put it out. And that's why people aren't getting serious infections and hospitalized. It's a COVID cold, just unlike all of the other colds. So let's think about it for a minute. There's a virus that causes cold called rhinovirus. Rhino means nose, virus. So if I went to the mall and got 100 people and measured rhinovirus antibody titers in their blood, I'd find it. A lot of these people are immune, but we still get colds, right? It goes to the nose, and that's the end of it. You may cough a little bit for a while, but unless you're really immunocompromised, you don't get problems with colds. So if you get boosted, even though you may boost your antibodies and your immune system, which was already robustly immune to COVID, stays that way, the virus still is going to have to get to the nose and replicate a few times before the immune system responds. So even if you get boosted, you'll probably still be able to get a COVID cold. So this is the shift, and we talked about this last time. For vaccinated people, the virus is changing from a serious infection causing a pandemic or epidemic to an endemic virus that causes colds. And we're going to be living with those colds from COVID, probably with all of the rest of the viruses that can cause colds for a very, very, very long time. But it's okay, because it's a cold. And the other cold viruses might be a little put off by this because they have to deal with another cold virus and competing, but that's what's happening for vaccinated people. So I'm not sure we really need boosters. Right now the data doesn't suggest it, unless you're in one of those groups that I talked about earlier. So with that, I'll go ahead and ask if there's any questions from the media or anyone in the room who wants to put out a quick one. Otherwise, we'll submit questions for next week. Yep, Randy.
What should people do or look out for if they are vaccinated but feel that they may have been exposed to COVID-19?
Yeah. So if you think you've been exposed and you've been vaccinated, what should you do? So the usual household here, the usual situation here, what I've been hearing, and get the question, is in a household, okay? So a child goes off to camp or has been, comes back in the house and then gets a cold, it gets tested, find out they have COVID, and then you have vaccinated parents. What should you do? One is have the child wear a mask in the house and have the parents wear a mask in the house until the symptoms are gone. CDC says 10 days, but the first few days is probably the biggest time frame. And otherwise go about your business. And then those who were exposed in that household should go out and get tested at day 3 to 5. And when they go out in public, they should be extra careful about wearing a mask. But if you've been vaccinated, you don't have to be quarantined, which means that you are free to move about as long as you remain masked and get tested at 3 to 5 days. If that test is negative, you're in the clear. So same thing if you were exposed to, say you had some friends over for dinner, and there's 4 or 5 of you, and then you get a call 2 days later sent from somebody, hey, I got a COVID cold, and it was within 48 hours of being at your house. Then those people who are at the dinner wear a mask when they go out and about, and then get tested at day 3 to 5, and if they're negative, they're in the clear. So for vaccinated people, quarantine is like quarantine light. But if you're unvaccinated, it's still the full Monty. You have to stay home for 10 days.
Do you have any concerns regarding the Delta variant and rising cases or hospitalization numbers?
Yeah, well, my concern about rising hospitalization numbers because of the Delta variant, yeah, we talked about that early on. Some hospitals are going to get tight, and some of the hospitals in our area have had to re-put together their command centers, which sounds kind of like a big deal, but to tell you the truth, in the world of emergency and disaster response, the command center is just a way for people to communicate regularly and more efficiently by getting together at periodic intervals through the day. And so it's really doesn't really mean that places are getting really totally stressed out. It just makes it easier for them to make decisions. I don't think that we're going to get like we were last January. I just don't think it's going to get that bad. Not in the triad. There are going to be areas in the country. Right now there's some places in Florida where there are really high pockets of unvaccinated people. Missouri, a lot of unvaccinated people in the Ozarks. But here our rates are high enough. I think it's going to largely keep us out of trouble. And you didn't ask, but the even more important thing is their deaths are going to be nowhere near what they were in January. Because the people, for the most part, the people who are vulnerable to death from COVID have been vaccinated. Yeah.
I have one question. What would you say to someone who's still apprehensive about getting vaccinated?
Well, what do I say to people who are still apprehensive about being vaccinated? Well, I tell them about the efficacy and safety of the vaccine. And I tell them the primary reason to get vaccinated is to be selfish and protect yourself and help protect your loved ones. If you're vaccinated and you do get a breakthrough, you have a COVID cold, and you are much less likely to give it to somebody else. It's not impossible, but it's much less likely. And then, lastly, I tell them that if you're unvaccinated, you're going to be stuck in the pandemic for a lot longer, and because the pandemic will be the same for you, for your individual risk, as it has been. But if you get vaccinated, it still gives you a way out. Yeah, you may have to wear a mask for a while, even if vaccinated, like we're going to during the next few weeks with this surge when we're indoors. But to tell you the truth, that's no big deal in order to be able to move about with peace of mind and do the things you want to do. You wanted to go to your nephew's wedding, you're vaccinated, you can go there without sweating it. Wear your mask when you're there at the reception, but you don't have to worry. And that feels good. There are some people who are worried about the safety. The vaccines are safe. I don't know what much more to say about that. The number of serious adverse events are so darn small. Your risk from COVID is so much higher. Interesting that this week there was a poll, one of the media polls, and they said that people who are hesitant about vaccines think that the risk from the vaccine is higher than the risk from COVID. That is absolutely false. That's a myth. The risk from COVID is much higher than any risk you might get from the vaccine. It's so much higher, it's like in the millions of times, say, better to get a vaccine than the cold, to get COVID. So, and then lastly, they say there's some people who are waiting for FDA approval. Maybe there really are. It's not that far off. But follow through. If you say you're waiting for FDA approval, when FDA approval comes, go get vaccinated. Don't say, well, now I'm waiting to get my car fixed first, or I'm waiting. That's kind of human nature, is that there's always something that comes up for the people who are afraid to jump off the high dive. But, so I thank you for that question, and sorry the answer was so long.
So we got one question. I know you've talked about earlier in the summer, but we just want to kind of talk again about the increase that we've seen in summer colds and illnesses, and the timing with that, and the lifting of mask mandates and reopening.
Yeah. So it's interesting that because the mask kind of went away at the beginning of summer, we're starting to see more colds, and particularly a certain virus called RSV that tends to affect young children and give them respiratory illnesses. So that is true. The masks were protecting us from that too. But it also means that this fall, when the colds are circulating and COVID is circulating, that if you give a cold, you need to go get tested for COVID. And so that's going to increase the demand for outpatient services for doctors. And I think almost every school is going to require people who get colds to be tested before they come back to school. So it's an important thing to remember. The other thing that I just thought of that somebody asked me to make sure I mentioned this morning is people are still concerned about the vaccines and their infertility for childbearing women. And I don't know how to say it other than it just is not a concern. The biologic plausibility of these vaccines causing infertility are just not there. There's no reason that they would, ever. We haven't seen it yet, and we've had now well over a year of experience giving the vaccines, and there have been no fertility problems in the people who have gotten it. We have never had a vaccine that interfered with fertility, ever. So it's just not a concern. And for people who are truly worried about it, I'll tell you that this rumor came from an anti-vaccination campaign where people literally just made it up. So it's just not true. There's no issues with So with that, I'll go ahead and hang it up. Send in your questions about what can I do or should not do during this surge, and we'll talk about that next week.